Hi, this is Anita Hummel from the Dusty Roads podcast about living life as a global citizen. This is Anita from the Dusty Roads podcast, and this is episode number 10. Today is part 2 of a 4-part series where I am going to talk a bit about poverty, or for in specifics, some of the contributory factors to poverty both locally and globally. The second reason last week we talked about literacy and education, and this week we're going to talk about how health and medical care can affect poverty issues. Health or ill health or medical care or the lack of can be a major cause of poverty. This is because the cost to seek proper medical care can drive people into poverty. But not only that, there are many people in the world who just don't have access to good medical care. So it can be the cost of medical care plus the lack of access of good medical care. I'm going to tell a story of a family that I learned about several years ago when I was in Tibet. A friend and I, we traveled to this part of Tibet, which was way up in the mountains. And this was the area that was between Chengdu, China, and actually Lhasa. So to go to this area, we had to drive by car. And also to be on the road, you had to have a special license plate. So we ended up in an army Jeep that was run by an army driver who was actually acted part-time as a driver for, I guess you would call tourists, but we were actually there to do some charity work. We were going to be delivering some school supplies up into some small schools in the area. We went to visit this one school, and there was this very nice man who was a principal, and it was a very small school up in the Tibetan mountains, probably an area where foreigners had never been before. And he invited us into his house, and we had this we were sitting in his little kitchen area, and he had the shutters open, and we're looking out over the beautiful snow-topped mountains, and we're, sitting on a bench which had straw on it, which probably also acted as the family's bed at night. And we got talking a little bit about his life and about him teaching school. He actually taught the Tibetan language and ran the school there. And then we got talking a little bit about his family. And he went into another room and he pulled out this piece of paper and he began to tell us a story about his son. His son was now 16 years old, but he told us that his son had never been able to get out of the first grade. And we said, "Oh, really?" But then he showed this picture and he said, "Oh, look, but my son can draw." When his son was a couple months old, he had an ear infection and became sick like many children do. There was no medicine. And there was no medical doctor. And because of that, his son ended up deaf. And because he was deaf and he lived in a small village, there was also no help for him to learn sign language or for, hearing aids or for anything else that maybe a normal child would receive in the United States or in a first world country. So instead, his 16-year-old son was still in the first grade up in these mountains in Tibet, all because the family did not have access to antibiotics or to proper medical care so that the son would not turn deaf due to this infection that he had or that so many children get. This is a story of, and this is a true story of how medical care can affect poverty. Here was somebody who maybe could have received an education, maybe would have even gone to university if he had not become deaf at a young age. So when you talk about medical care or you talk about health care, it's really two factors. One is access, that there's a large part of the world's population that just doesn't have access to medical care or proper medical care, like my friend in Tibet did not have. They just live so far up in the mountains. They live away from any major hospitals. The doctors and nurses that they might have there are maybe not well trained, or they simply don't have the medicines that are needed for some very basic diseases. The other is, of course, people who live in first world countries who end up getting sick but don't have the proper insurance. So they, in a sense, become health poor. Their health care or the cost of their health care drives them into poverty. With my work in Project Sprouts, I have seen firsthand how devastating it can be when you visit some of the small villages outside Hanoi. I've been to homes where the children have had nothing, absolutely nothing. I mean, you would not see a toy in that house, all because they had a father, their major breadwinner, who died of a disease. And so because of that, the family lost everything. And in circumstances like this, it becomes very hard for many of these children to be able to continue schooling and other things. Sometimes they are again forced into the workforce to help support for their families or to help make up for the income that was lost due to having a parent that dies. In some cultures, when a woman loses a spouse, it's almost impossible for her to remarry due to the social or cultural stigmatism. With the death of a spouse, she is almost ensured that she will live in poverty. The World Bank, in speaking about healthcare, said, "Strong healthcare systems improve the health status of the whole population, but especially of the poor, among whom ill health and poor access to healthcare tends to be concentrated, as well as protected households from the potentially catastrophic events of out-of-pocket healthcare costs. In general, poor health is disproportionately concentrated among the poor." This is very, very true. When you go out into these villages or these small towns, you can hear of people who die of diseases that somebody in the first world would never die of today. You hear of families who have lost everything because they had a loved one who was sick. You hear of children who are born with some kind of defect who get absolutely no type of help at all because there is no help available. Just like my friend in the Tibetan mountains who had a son who got a cold that turned into an infection, and there were no antibiotics to ensure that his son would not turn deaf. This is what really happens, and this is why health and medical is also one of the contributory factors to poverty. It is because so many people in both the first world, which is the developed world, the developing world, and the undeveloped world, get tossed and thrown into poverty because of health issues or the cost of health care, or also the lack of no health care in their area. We really feel if you are planning to live overseas, or if you're just interested in the world, which we all should be, or you like to travel, and if you're going to travel to a undeveloped country or a third world country, it's important that you understand some of these things because you will see them. Or maybe you will see them but not really know or understand what you're seeing. So it's good for you to understand what you are seeing and to realize that what we think as a simple solution may not always be so simple. That not everyone has access to the proper medicines they need, even for some simple diseases. Thank you so much for listening. I truly do appreciate you listening. I know I've said this before and I'll say this again. Without you listening, it would just be me talking to myself. So thank you so much for listening. And we hope that you'll tell your friends if you've enjoyed this. Give us a thumbs up and pass it around. And become part of our community. Come right along with us on the dusty roads of life. Check out our blog, A Bus on a Dusty Road, and sign up for our newsletter. And continue living life as a global citizen. Thank you so much for listening. This podcast is sponsored by A Bus on a Dusty Road, a blog about living life as a global citizen. Please go to our blog at abusonadastyroad.com and sign up for our free newsletter. If you've enjoyed this podcast, give us a thumbs up, leave us a review, and help to pass this along. Thank you so much for listening.